Okay, admit it. I know you've done this before. You've used the internet to look up symptoms and diagnose yourself without a visit to the doctor. With Google and WebMD, we all think that we're medical experts nowadays, right? Well, wrong. According to the Pew Research Center, more than 72% of internet users say they have looked online for health information, but that can lead to worry, missing an important diagnosis. It can lead to wrong information. We're calling these people cyberchondriacs, and Dr. Sharon Thompson is in to help us stop this habit and avoid cyberchondria. Good morning.
Absolutely.
Happy New Year.
Good morning. Happy New Year, everybody. The internet is full of information, and that's wonderful. But it's also full of bad information and worrying information. And certainly, if you're having a little stomach upset, you're feeling nauseous, well, that's a symptom of everything from the bad food you ate yesterday to fatal leukemia. And when everyone searches the internet, they become convinced that they have the fatal leukemia.
Right.
You probably don't.
You probably just need some Tums and to clean up the diet a little bit.
Absolutely.
So what do you think people, I mean, obviously we don't also have the language that a medical professional will have. You know, something aches here, you know, there's different words that you would use probably to describe something.
Definitely. And you know, your medical provider, your doctor, your nurse practitioner is an expert. They were educated for many, many years so that they can be an expert for you. So use them. I mean, because we can understand most of the language on the internet, you don't overlook the experts who are available to you. The other thing about the internet is no one's in charge. So there's no one monitoring what comes across your computer screen, and it's often hard to figure out which internet sites are reliable, which are for pay, which depend on advertising, and so it's just a minefield, and the worry isn't worth it.
Too dangerous. Do you find that patients come in to see you and they say, well, I looked this up and I'm pretty sure I have this?
Yes.
And especially with a pregnancy, I mean, that can open a lot of doors of something's going wrong because I looked up this after I felt.
So that is one of the things. I'm an OBGYN, so I'm biased, but please don't look up your pregnancy symptoms online. In fact, my patients all know, and I tell them, I give them a list of websites that I find are reliable if they must go on the internet, but I recommend that they don't because it causes more worry than help.
And that is on the list that we're taking a look at here of the things that we should not be looking up. What are some of the other notes that made your list?
Definitely.
Why?
If you're having chest pain, it feels like something's sitting on your chest, that is not a time to go to Dr. Google. Go to the emergency room. You definitely need to seek medical treatment. Moderate to severe pain that's not responding to an over-the-counter remedy, you absolutely need to see someone, or at the very least call your doctor. Symptoms of depression and mood change, not an internet time. And as we said before, pregnancy-related symptoms, please call your doctor. Your doctor should have an emergency number that you can reach them any hour of the day or night. Trust me, people know about this number. So use it. Don't feel shy.
If you're really worried, you need to get that medical advice, and don't stay up at night.
Don't be a cyberchondriac.
Right? Dr. Thompson, thank you so much. No cyberchondria. Gina?